Dentists in Washington are still reeling from big cuts by the state's largest insurer. Some dentists say reduced claims payments will have an impact on patient care.
Now, a King 5 investigation reveals the reason why executives at Washington Dental Service have such big smiles on their faces. Chris Ingalls reports on their salaries and how Washington Dental avoids paying millions of dollars in taxes every year.
Mind if I take a peek?
No.
Thank you.
Dr. Chris Piquel is a longtime North Seattle dentist.
Go ahead and bite for me in your back teeth. Excellent.
Who feels like he's been kicked in the teeth.
Open just a little for me. Thanks so much.
Last year, Washington Dental Service, an insurance company, made a decision that affected almost every dentist in the state.
We were already operating with pretty slim margins, and so when this announcement came that we were going to get a 15% reduction, there was just really nothing left to cut.
Washington Dental Service, part of the nationwide Delta Dental Network, cut the fees it pays to dentists for all procedures.
They're the biggest carrier of dental insurance in the state.
So dentists everywhere are trying to make up for lost revenue.
It's the patient that loses. We basically have had to see more patients. We've had to figure out a way we can compress patient time.
Is Jim Dwyer worth $1 million a year?
Yes, I think I am.
Much of the dentist's anger has been focused on Washington Dental's $1 million man, CEO James Dwyer. He earns $1.2 million a year.
I'm very happy with my compensation. I don't want to, there's no hubris in this. I really am very happy. I gave 10% of it back this year.
We obtained 5 years' worth of tax records and found that Washington Dental executives have prospered even during the Great Recession. Compensation for officers and key employees grew to $5.8 million a year. That's a 32% raise over 5 years. Dwyer's pay rose even higher, 45% in 5 years.
We've increased revenues every year, and we are now close to $1 billion a year in revenue.
Sounds like your typical corporation, right? But here's the thing about Washington Dental Services. It's actually a nonprofit. That means it's exempt from paying millions of dollars in federal taxes every year. Tax records show Washington Dental's nonprofit status exempted it from paying taxes on $13.7 million in net income in the year 2010.
We fund our foundation to the tune of $5 million a year.
Dwyer emphasizes Washington Dental is not a charity. It's the type of nonprofit that the IRS calls a social welfare organization. It spent $5 million to help build this groundbreaking pediatric dentistry clinic in Seattle.
These are initiatives that require a lot of money, and we're quite proud that we don't have shareholders that we dividend the profits to. We put it into our tax-exempt mission.
Without oversight, the nonprofits can drift towards a more for-profit kind of model.
State Senator Cheryl Flug is an outspoken critic of tax breaks for certain segments of the healthcare industry. She questions whether the public benefits outweigh the perks for the nonprofits.
I don't know a lot of people that got a 45% salary increase over the last 5 or 6 years. So that sounds suspicious.
Washington Dental says it made the cuts last year to reduce premiums and offer cheaper insurance plans to employers. That, after a study showed it was paying dentists some of the highest fees in the nation.
They've lived in a wonderful, insulated world. God love them, but it's changing.
Dentists may not appreciate his $1 million advice. Work harder.
Number one, they could start working 5 days a week.
You've done a nice job.
Chris Ingalls, King 5 News.
The state insurance commissioner handled more than 150 complaints about Washington Dental Service last year, far more than any other dental insurer. A spokesman says the office has no jurisdiction over reimbursement fees to dentists or medical doctors.